It's your Friday Newsbuzz edition of River to River from IPR News. I'm Ben Kiefer on this 10th day of July, 2026. Well, Iowa has confirmed its first measles case of 2026. It was a vaccinated Polk County adult infected while traveling internationally. And health officials have released a list of public locations across the metro area where others may have been exposed to measles. At the same time, Polk County Public Health is rolling out something new. It's an automated dashboard that will let schools share daily illness and attendance data so the county can spot outbreaks before they spread. I spoke about these things with Juliann Van Liew, Polk County Public Health Director, yesterday. Juliann, welcome back to our program.
Thanks so much for having me.
Let's talk about this first measles case. Walk us through, please, what happened here. Who is the patient? How did they contract measles?
Sure. So we've got a fully vaccinated adult individual here in Polk County. Because of that full vaccination status and not having any community spread that we're aware of for measles in Polk County right now, we feel fairly certain that it was likely an exposure that happened on that international trip, not that it was acquired here locally.
Okay, this person was vaccinated, Juliann. How does that change the picture for you, both for how sick they got and how likely they were to spread it?
Sure. This is one of the things we know that's most confusing to folks, that feels sometimes, I think, frustrating when we hear over and over that we need to be vaccinated to not get measles, to help stop the spread. But unfortunately, no vaccine is 100% effective, right? So we know that somewhere around 7-ish% of measles cases are going to be among those cases who are vaccinated to some extent. But it is still extremely helpful, like in this case, when someone is vaccinated, because what that means is that they're much less likely to become very ill, as is the case in this situation. We have someone who is recovering nicely, but they also then have a viral load and a lower opportunity to really pass that on to others. So it does impact whether or not that person is going to transmit that at a high level. So even though they've still acquired measles, having those two vaccines is really helpful in a situation like this.
Mm-hmm. You've released a list of locations across the metro where this person was. How was that list put together? How confident are you that it's complete?
I feel very confident. We've worked on this list over and over at the health department and with the state and with the individual and their family. This person has been so highly cooperative. We really, really appreciate how much they've worked with us to get these times right, to make sure we know the exact addresses and locations. Many of those locations we've talked to already, but getting the timing just right is really important because we know that measles can linger in the air. We need to make sure we have that right window to tell folks. But in this case, because of the quality of information we're getting, and we've been able to verify it in a number of cases, we feel very confident that this list is appropriate.
Can you give us a quick survey of the list? And for someone who thinks they may have been at one of these locations, what should they be watching for, and for how long?
Yeah, so these locations span from Wednesday, July 1st through Sunday, July 5th. You know, we've got a Dollar General, a Family Dollar. We do have a couple of healthcare settings, unfortunately, which we consider to be higher risk, because you often have individuals in those settings who have a weakened immune system, themselves are sick. So those are our highest priority, and we're working really closely with those healthcare settings to contact all those individuals who are in those waiting rooms or in those facilities. But we also do have a couple of churches. We've got a Quick Star, an Under Armour, and then Iowa Clinic Urgent Care. So there are a number of sites. Different sites have different level of kind of risk, depending on if someone was in that site for a long time or whether or not they were in a Quick Star kind of quickly walking through. But the most important thing is just to review the list. Make sure you're thinking back correctly to the right days, making sure that you know whether or not you were in one of those spaces. If you were, we'd really like you to connect with us. So you can go to polkcountyiowa.gov, and at the top of that page, folks are going to see a survey. Very simple, very easy to fill out, available in Spanish, to let us know which one of those locations were you at and when, and provide us some really basic information like, have you been vaccinated? Where have you been? Were you with other family members? And by giving us this survey, then we will reach out to you to talk about your unique situation, to talk about your level of risk, and to help you know what to do next.
Okay, at polkcounty.gov, you can find the list of locations across the metro and the survey you just mentioned. That's good for both of those things.
Yes, and I want to also make sure folks know our measles call line at the health department is 515-323-5221. You do not need to be a Polk County resident or one of our previous health department clients to visit our website, do the survey, call us for support. We want to make sure folks know that we are here and ready to take your calls and answer your questions.
Okay. If you've been at one of these locations, get in touch. But should people also be watching for symptoms and for how long and what symptoms?
Yes, thank you. So people often hear about the measles rash, and that is something that's highly noticeable usually. It's one of the things that is often most associated with measles. But often, even before that rash, we've got a fever, we've got runny nose and some congestion. We've got some of those more typical symptoms that you could associate with just a case of the cold or something like that. We also see sores inside the mouth that are often white. So if you're seeing any of these, particularly that fever that's often preceded by that rash a few days later, those are telltale signs that you'll want to make sure that you're paying attention to yourself for and contacting a healthcare provider if you're seeing any of those and have been to one of those exposure locations.
Mm-hmm. Juliann, nationally, there have been over 2,000 measles cases this year. This is Iowa has had very few. This is the first of this year. Should we in Iowa see this as an isolated case or an early warning sign of things to come?
One of the things that we can feel good about right now in our current situation in Iowa is that this was likely not locally acquired. So we're not seeing that community transmission, which means somebody in our community transmitting it to someone else in their community, in a workplace or school or what have you. The fact that this was highly likely acquired abroad is a really good thing. But I think what we're going to see moving forward is more of this, right? So whether it's locally acquired or abroad, people will continue to travel internationally as well as to other states where we continue to see hot pockets of measles showing up. So it's very likely that this is a continued part of our future. It just may look different year to year depending on kind of what's happening around us in other states and other areas.
If you just joined us, a conversation currently with Juliann Van Liew, Polk County Public Health Director, about the first case of measles in Iowa this year. Juliann, I wanted to talk about some exciting news, a new school illness dashboard. Tell us, what does the new dashboard do, and why did Polk County decide it needed one now?
Sure. So I want to be clear, this is really just an evolution of the work that we've done over time and continue to do to understand the spread of disease in our community. So historically, how it's worked is our school nurses located all around the county in different schools need to submit information to the state and then separately to us to make sure that we know how many kiddos they have out on any given day. But what we're doing here is modernizing that situation, really freeing up those school nurses so they don't have to report that directly to us. They just share data immediately with us in the back end. And that data can be incredibly powerful because that data sometimes can show us things before we actually see it in our healthcare numbers at the hospitals or in any of our health outcomes. Oftentimes those kiddos are kind of the canary in the coal mine. So what's really exciting about this is the ability to automate that, have all that data come in the back end to Polk County so that we can be checking, especially during, obviously, the whole school year, but during that respiratory season where we see that uptick, November, December through the end of March. It allows us to every day check in and see, are we getting closer to that 10% threshold where we get really concerned? Do we need to be doing more coaching with that school nurse? Do we need to provide more guidance to certain superintendents? So it gives us a ton of information and it helps us be able to more readily prepare and react when we do see these changes.
Mm-hmm. When do you expect this to be running for the new school year?
Yeah, so we're working really, really hard. We're so appreciative of our school districts who have opted in. We're very diligent in the health department around what data we receive and share and keeping all of that confidential and protected. So we're doing all of the hard work right now of making sure that data flows in securely. And it will start with a back-end dashboard that our staff can monitor kind of every single day, day in and day out. with the hope that eventually we could potentially go public facing and allow for more of the public to monitor that with us. Again, not to be kind of the definitive source of, is there spread in our community or not, but to be one of many sources of information.
Talk about that public-facing version. That's not happening now, but could happen in the future, because I imagine parents out there would love to monitor the illnesses in specific schools, and that's what an aim is here eventually, right?
Yes, it is. This is, in public health, we need data ourselves to make smart decisions as professionals, but we really need data to arm our community members. People can't make the right and healthy decision for them and their kids if they don't have all the information that they need. And again, this is one more place where we believe there should be transparency and the ability for parents to kind of know. Not that schools aren't being transparent, I want to be clear, but as much as we can aggregate data and bring it together to show a large picture, to show where there's geographic variability across the county in terms of school illness, that's all stuff that can be important for decision making and should be out there for folks to understand.
Juliann, I feel it's worth circling back what you mentioned earlier about vaccination. What is your message to Iowa parents about the vaccine schedule, especially given some of the newer guidance, the misinformation around vaccines so prevalent these days?
It's absolutely as important as ever to make sure you're up to date, your kiddos are up to date with vaccines. Here in the Polk County Health Department, we really continue to support the traditional vaccine series that has been proven to work and be effective. And so as we soon, unfortunately, turn around and head into another school year before we know it, this is a really great time, again, for parents and others to stop and pause and assess, make sure that they're protected and ready, and to remember that even though it doesn't cover every single case and prevent every single measles infection, it's still really valuable in terms of minimizing that spread and reducing the severity of that illness.
And once again, polkcounty.gov is where you can find the locations across the Des Moines metro area where there could have been a transmission of that measles case. You can find that as well as a survey to pursue that and get in touch with Polk County Public Health if you were at one of those locations. Juliann, thank you very much for this important information.
Thank you. We appreciate you spreading the word.
Back with more of your Friday News Buzz in just a moment. It's River to River from IPR News.
It's your Friday News Buzz edition of River to River from IPR News. I'm Ben Kiefer. Dementia is no longer a distant worry for aging Americans. It's a fast-growing reality across the Midwest. More than 270,000 people, 65 and older, in Iowa, Kansas, Missouri, and Nebraska are living with Alzheimer's disease, and that number is expected to climb sharply as the population ages. But in many rural areas, specialists are scarce. Wait lists stretch over a year, and families are driving hours for basic care. Reporter Luke Nozicka of the Midwest Newsroom, he's based in St. Louis, spent time with one Missouri couple fighting to change that and looked at how Iowa, Kansas, and Nebraska are each responding differently to what advocates call medical deserts. I spoke with Luke yesterday. Welcome back to our program, Luke.
Hi, thanks so much for having me.
What made you want to dig into dementia care access across this specific four-state region right now?
Sure. So I first became interested in this issue because a couple here in Missouri is advocating for the state to create a statewide dementia services coordinator. This would essentially be a government employee who leads the state's dementia strategy, kind of working across agencies and connecting families to services, especially in rural parts of the state, and parts of the state that, as you mentioned, some people consider to be so-called medical deserts. Proponents of this say that a statewide coordinator would be a lifeline to the longevity of people with dementia because they can help with things like early detection and intervention. And so I got interested in this because establishing a position like this in a state health department is part of a health care bill here on the Missouri governor's desk at the moment.
Mm-hmm. Let's make sure we all understand what a medical desert is. Is there a strict definition for that, or basically just there's not enough medical care to fit a certain population?
Yeah, I think it's really the latter. A couple I spoke with, Bobby and Sandy Marshall, use this term to describe where they live in southeast Missouri. They had previously lived in Florida, which has an older population, but they kind of had more access there to resources for Bobby, who has early onset dementia. He was diagnosed at age 55. And so now they drive nearly 3 hours from their home to his appointments in St. Louis to see specialists. And so that's not uncommon across some rural parts of the Midwest.
Yeah, and so that's why you focused on Bobby and Sandy Marshall's case, because you built the story around them because, well, early onset Alzheimer's for one, but also because they've changed locations and had a real contrast in the medical care they were able to receive.
Yeah, that's right. And they've told lawmakers here in Missouri as much. I kind of centered the story on them as well because their personal narrative is really relevant to some of the state policies they've advocated for. So they decided to get a kind of baseline cognitive assessment to see where each of them was more than 10 years ago after Sandy's father died of Lewy body dementia. And when they did that, they learned that Bobby had early onset dementia. And so, yeah, he really embodies the importance of early detection. He was told he had just 5 to 8 years to live when he was diagnosed, and that was more than 11 years ago at this point. And so, he very quickly changed his diet and now takes FDA-approved medication meant to slow the disease and still does things like drive himself to the grocery store in town.
Mm-hmm. Let's talk about the policy landscape you looked at here in these 4 states, Missouri, where you are, but also Kansas, Nebraska, and here in Iowa. How does the policy landscape compare? Because this is really interesting. Each state is quite different in how it's meeting this challenge.
Sure, yeah. There are a number of policies, we could look at to kind of compare and contrast. One representative at the Alzheimer's Association said that kind of broadly speaking, each state is making progress in its own ways, though some in our region have had to do so with difficult budget years. But last year, for example, Nebraska passed insurance coverage for biomarker testing, which can help with earlier and more accurate diagnosis. And then on the other side of Iowa, also last year, Illinois became the first state to require state-regulated health insurance plans to cover treatments that slow the progression of Alzheimer's and related dementias. And then, an issue that I focused on in the story, like I mentioned, the Marshals have advocated here in Missouri for a statewide dementia services coordinator, and that's a position that exists in Washington, D.C. and 32 states, including Illinois, Minnesota, Kansas, and Nebraska.
Mm-hmm. Iowa, the one state in this story without a statewide dementia coordinator. What have you heard, Luke, about why that is and whether that's likely to change here?
Yeah, so I know that in the last couple of years, there has been proposed legislation to create such a position in Iowa. There are kind of mixed beliefs on what should maybe happen, but some have been advocating for kind of a top-down statewide government position that would lead the state's dementia strategy, while others have advocated for a more kind of localized approach where service specialists would be spread kind of across the state.
Mm-hmm. Now, Broadlawns in Des Moines just launched Iowa's first mobile memory clinic, and we've had the director of that clinic, Dr. Shaw, Yogi Shaw, on this program many times. How significant a step is that for rural Iowans? And could this be a model for the rest of the state to help with those deserts of access, the medical deserts?
Sure. Yeah, I think it's a significant step, especially because it is the state's first mobile unit that provides such services. It's my understanding that they travel to neighborhoods and community centers in Polk County and provide, educational programs, resources for caregivers, as well as memory evaluations and blood tests to look for specific biomarkers. This is something that the Marshals actually, when they lived in Florida before they moved to Missouri, had advocated for in Tallahassee. And so there are now 2 quote-unquote brain buses that drive across Florida doing similar work. So I think it's something that certainly advocates would love to see expanded here in the Midwest.
Yeah. Luke, what more can you tell us about the scope of dementia here in Iowa?
In Iowa, there are about 62,000 people living with Alzheimer's disease, while there are about 80,000 Iowans who provide unpaid care, and that's according to the Alzheimer's Association. Looking back a few years in 2024, there were more than 1,300 deaths from Alzheimer's across Iowa and almost $900 million in Medicaid costs for caring for people with the disease. And so kind of generally speaking, to meet the demand for care in the next 25 years, the Alzheimer's Association says that Iowa needs to see about a 110% increase in geriatricians across the state to kind of, help people living with the disease. And I should say that all of these figures are expected to climb in the coming decades as the U.S. population continues to age.
That's quite a gap you point to, Luke. Is there any realistic path to closing the gap there in the increased need for geriatricians over the next quarter century?
Yeah, it's something that advocates certainly hope for. I didn't focus on it a ton in this story, but it's similar to other states kind of across our region that they need to see a huge increase in people who care for older patients. You know, some people who work in this space say that Iowa is actually among the more quote-unquote dementia-friendly states, at least as the website caring.com puts it. That site this year ranked Iowa as the third most dementia-friendly state, and they kind of cite the decline in deaths related to Alzheimer's over the last 5 years to come to that conclusion.
Mm-hmm. Luke, after spending this much time on this story and with families living with dementia, is there something that lingers in your mind, perhaps a misunderstanding, a surprise about this disease that stuck out for you?
Yeah, so millions of Americans live with dementia, so I imagine some listeners have firsthand knowledge of the disease. Many people I spoke with or quoted in this story, including lawmakers, had at least one relative living with dementia. But for people who might not be as familiar, while there isn't a cure, there are certainly ways through medication and lifestyle changes that can help slow the progression. And some listeners may have kind of an inaccurate image in their head of what of a dementia diagnosis, meaning that the person with it is potentially completely helpless. You know, I've heard advocates kind of talk about this, what people might imagine in their heads, when the reality is that there are many people functioning who live with the disease for years. And so that's why I also thought it was important to focus on Bobby Marshall, who, 11 years after his diagnosis still golfs with his friends regularly.
Okay, Luke, we'll end on that positive note. Luke Nozicka of the Midwest Newsroom, based in St. Louis, talking about dementia and medical deserts in Kansas, Nebraska, Missouri, and here in Iowa. Thank you, Luke.
Thank you so much for having me.
It's your Friday Newsbuzz edition of River to River from IPR News. I'm Ben Kiefer. Well, we know Iowa's drinking water facing trouble, in fact, more nitrate trouble than it has in years. A new state report shows public water systems recorded 36 nitrate-related violations in 2025. That's more than double the 14 violations logged in 2024, and enough to affect nearly 2,500 customers. The problem stretches from small campgrounds and rural water systems to the Des Moines metro area, where record-high nitrate levels last summer, you remember, triggered the region's first-ever lawn watering ban. Iowa Capitol Dispatch reporter Cami Koons has been tracking the numbers behind Iowa's nitrate problem. I spoke with her yesterday. Hi, Cami.
Hi, Ben.
First of all, walk us through the basic numbers in this new report. How many violations, how many systems, how many Iowans affected?
Yeah, you kind of gave the highlights there. So there were 36 nitrate-related violations, and that's talking about where the public water system recorded contaminant levels of nitrate that were above the EPA maximum, which is set at 10 milligrams per liter of nitrate. So that's what the violation means. There were 36 of those across 13 different systems. So some of those systems had multiple violations is what that means, basically. And as you mentioned, there were 14 in 2024, and that was at just 9 systems in the state. Although it is worth noting that in 2023, there were also a lot of violations, nitrate-related violations. Mm-hmm. There were 38 in 2023, but a graph from like 2016 until now shows that the 2023 and this year were kind of outliers as far as having a lot of violations.
Cami, so is what you're describing a steady climb or more of a spike and dip pattern?
Definitely a spike and dip if you're looking at, from 2022 to 2023, 24, and 25.
Mm-hmm. More than half of 2025's nitrate violations came from just 4 systems, including a church, a couple of campgrounds, one municipal supply. What does that tell you about who's most exposed?
Yeah, I mean, I would say the majority of these violations occurred at what the EPA and DNR classify as transient non-community water sources. So these are places like a gas station or like a campground where they have their own water system and they regularly serve more than 25 people. But they're, it's not like a municipal water supply, even though there was one of those top violators was a municipal water supply. But I think that's showing that these, nitrate removal systems are really expensive, and a lot of places can't afford to put them in. Even a lot of communities can't afford to put them in, let alone, a gas station that's, just pulling from its own well on the property.
Right. More than 90% of Iowa's systems pull from groundwater, but surface water systems serve nearly half the state's population. And that split matters for nitrate exposure, doesn't it?
Yeah, for sure. So a system that is influenced by surface water, so like here in Des Moines where we pull from the Des Moines and the Raccoon River, when those rivers are high in nitrate, that's going to impact our water utilities' ability to get those nitrate levels down versus if they were pulling from much further down in the ground, like a deep well.
How does this fit in with the news we've been hearing for years about the Central Iowa Waterworks?
Yeah, I think it's worth pointing out that Central Iowa Waterworks did not have any violations, even though nitrate contamination is a big topic here in Central Iowa that we've heard a lot about with the lawn watering bans. So those lawn watering bans were issued in effect so that the utility would not have these violations. So by reducing the demand on the system, they were able to get those nitrate concentrations in the finished water out to customers below the EPA limit. So these, systems that are having these violations are not able to manage that level before it goes out to customers.
Cami, let's remind ourselves of the health stakes here. Nitrate above the EPA limit is especially dangerous for infants, but there is also a belief that nitrate exposure, even below the federal limit, may still carry health risks, and not just for infants, right?
Yeah, this is a big concern. I mean, I think Iowans with the, consistently high cancer rates that we keep seeing are looking for any trend that separates us from other states and trying to, see if there is a connection to the cancer rates there. So the EPA limit is specifically talking about blue baby syndrome, as you mentioned. We know for sure that concentrations above that 10 milligrams per liter can be fatal actually to infants. But it's still the research, or at least the EPA has not come out and said that there are other health effects that it's concerned about with nitrates.
Mm-hmm. When a system racks up repeated violations, like you noted in this story, 9 in 1 year in one case, what actually happens to force a fix?
Yeah, so DNR basically works with them to try to get compliance to be met. If compliance is not met, which means, bringing those totals down in a timely manner, then they can issue like an administrative order, which sometimes that can have a penalty attached to it. And then those can also be escalated to like the EPA or to the Attorney General.
Mm-hmm. We've talked about water quality several times, Cami, and it's a topic we cover quite a bit here on River to River. I wonder, from your reporting and your emphasis on agriculture and the environment, stepping back, what does this latest report tell us about the trajectory of Iowa's water quality problem overall?
I think it shows that a lot of systems are struggling with the question of how do we balance the nitrate issue? How do we deal with it? Obviously, the systems have to legally supply water that meets the EPA safe drinking water standards. But, I think they also want to make sure that their residents are getting safe drinking water. But it's difficult to do as the rivers have been high. They've remained high since last year. I think it's just continuing to be a problem that Iowa communities, and even now we're seeing small little truck stops and camps that are pulling from probably their own well, are also facing.
Cami Koons of Iowa Capital Dispatch. She covers agriculture and the environment. Thanks once again, Cami.
Thanks so much.
Still to come this hour, Iowa volunteers racing to track the state's disappearing bumblebees. IPR's Rachel Kramer on that. Des Moines is looking for ways to help close a budget gap created by the new property tax law. I'll talk with the city manager of Des Moines, Scott Sanders, and IPR's Cece Mitchell grooves us into the weekend. Let's take a short break. I'm Ben Kiefer. It's River to River from IPR News. It's your Friday Newsbuzz edition of River to River from IPR News. I'm Ben Kiefer. Coming up, Des Moines is looking for ways to help close a budget gap created by the new property tax law. We'll hear about that. Also, IPR's Cece Mitchell grooves us into the weekend. But first, we know bumblebees are essential pollinators for our crops, our ecosystems. But scientists say roughly a quarter of North America's native bumblebee species now face some risk of extinction. For the past 3 summers, Iowa volunteers armed with nets, coolers, and cameras have been fanning out across the state to help track them. It's called the Iowa Bumblebee Atlas. It's a community science partnership. Iowa IPR's Rachel Kramer has been reporting on this. I spoke with her earlier today. Hi, Rachel.
Hi, Ben.
For people who've never heard of it, what exactly is the Iowa Bumblebee Atlas?
Well, you described it really well. I mean, it is volunteer powered. Volunteers each summer between June and September go out into an area to try to find bumblebees. These are 45-minute surveys, and there's a whole process of catching the bumblebees with nets, putting them into a little vial and cooling them down to basically slow them down so that they can take photos, and then they release them and they upload that data into an online portal where experts will verify their observations. And it's part of this big data collection project to understand where different species are in the country, well, in Iowa and the country, and to better understand what types of habitat they need so that, groups can try to conserve this group of species.
Yeah, and there are many different species of bumblebee. For instance, mentioned in your piece, the rusty-patched bumblebee, the first bee species ever federally listed as endangered. Volunteers are doing this work. I guess volunteers, a good first question, common question would be, how nervous should I be about getting stung?
Well, I spoke with Stephanie Shepard, who is a wildlife diversity biologist with the Iowa Department of Natural Resources, and she was saying that bumblebees are actually pretty docile, and their volunteers go through a thorough training process, and she said that putting them in the vial usually isn't going to be something that would lead to somebody getting stung. She said in her 8-9 years that she's been doing research with bumblebees, she's only been stung twice, and she even joked that she was just not paying attention. And so she didn't think that would be too much of an issue. And there are several trainings coming up this month scattered throughout the state so that volunteers can get hands-on experience doing this process so that they can become more comfortable with it. She said, that she can understand how it might be a little bit intimidating to go out into a field and catch bumblebees, but with this training experience, hopefully it just helps people feel more confident to go out and do that.
As I mentioned, nearly a quarter of native bumblebee species face some level of extinction risk. What's driving the decline? And besides the fact that they're just wonderful creatures, why do we want them in our environment?
Sure. I mean, I think that a lot of researchers are still trying to pinpoint it. When I've talked to entomologists in the past, they'll often say that it could be a combination of a lot of different factors: climate change, pesticide use, loss of habitat. Those are often some of the 3 big culprits, but it can also be a combination of those. And, at least by providing habitat, I remember speaking with someone a year or two ago who really emphasized that if we can provide habitat, then they at least have a place to eat and shelter, and that can really help them with some of the other challenges. But yeah, I mean, bumblebees are important pollinators for native ecosystems. They're also important pollinators for agriculture, especially with food crops, vegetable crops. And so, a lot of scientists are worried that if we lose these bumblebees, then that could have big changes, and big, that could create big problems down the chain of the food web and all of these different ecosystems.
And the benefits of bumblebees to our ecosystem?
Bumblebees are very important for pollinating native ecosystems, and then also they play a big role in agricultural production, especially with vegetable crops.
All right, thanks, Rachel. And of course, the simplest thing that Iowans can do is to have a pollinator garden. Devote some of your otherwise grass to something that feeds those pollinators. Thanks, Rachel.
Thank you, Ben.
It's your Friday Newsbuzz edition of River to River from IPR News. I'm Ben Kiefer. The city of Des Moines is staring down a budget gap that after a new state law capped how much local governments can grow their property tax revenue. City leaders have floated closing a pool, cutting library hours, even scaling back police services to close it. Now, Mayor Connie Boesen is trying a different approach, asking the state, hospitals, other tax-exempt property owners to voluntarily pay the city something anyway. It's through a decades-old program called Pilot, Payments in Lieu of Taxes. Earlier today, I spoke with the Des Moines City Manager, Scott Sanders. Scott, welcome to our program.
Yeah, thanks for having me.
For those who haven't been following this closely, what did the new state property tax cap actually change for a city like Des Moines?
Well, the simple view of that is that they have capped the growth in our property taxes year to year at 2%, and that obviously is a lower percentage than what we see in inflationary costs to continue our services, and that's what's creating a majority, or for the most part, the gap that we're seeing.
How big is the gap your city is trying to close?
So for the next fiscal year, that doesn't even start until next July, fiscal year ending in 28, that gap is estimated at the moment to be about $12 million, and that is only the general fund operations. We will also have to take cuts in our sewer utilities and some of our other enterprise funds, as well as our capital funds, and including those as well.
Yeah, I mentioned some of the ideas floated by city leaders. How real are those options at this point? Closing a pool, cutting a library, police services, in worst case scenarios, are those really being considered?
Well, I think it's important to understand that we are very early in the process yet and have intentionally started the process 4 to 5 months earlier than normal. We want to get an understanding of what can be on the table and what other service levels we believe are already at their minimum and would not want to see, further disinvestment. So we're still another month or two out from actually having proposals. At the moment, we're just identifying what the options are.
You have billions of dollars of property value in Polk County that isn't taxed at all, and this voluntary payment program goes back to the late 1990s, I understand, Pilot. I understand that, for instance, no hospitals have made a pilot payment in 5 years.
Yeah, so Pilot is a payment in lieu of taxes, but by Iowa law, they are only voluntary. And so it is a conversation with those nonprofits to express the concern we have within our budget to provide public safety, transportation needs that even our nonprofits, utilize. And so the burden of their public safety at nonprofits are essentially paid for by all the rest of us as homeowners and business owners and property owners. So when it originated years ago, there was an understanding of that shared burden and a willingness for the hospitals and only really a couple other churches and whatnot back then that would contribute a payment in lieu of taxes. We also have our public utilities that contribute to that as well. But what has changed is we do no longer and have not for years received a payment in lieu of taxes from our two major hospital systems here in town. There's also no payments that come from like the state government utilization of the land and the public safety that they also partake in as owners of property here in Des Moines.
We're speaking on Friday morning. As of this time, has your city, gotten a single written response to the mayor's letters regarding pilot?
I'm not aware of any responses at the moment. There has been discussions with Broadlawns wanting to understand it better, so I give them credit for at least reaching back.
Yeah. What does that silence or near silence tell you about whether this is a potential, at least partial fix for the gap?
Well, so we have had conversations over the last 2 years with the hospital systems, and as you might imagine, they're struggling with their own fiscal situation. So it's not unusual or unexpected that they're struggling with the priorities of their own budgets and how does local public safety fit into their responsibility, civic responsibility to help contribute to.
Mm-hmm. Let's broaden this out because all of Iowa is listening to this conversation. How much of what you're facing here is reflected across Iowa? I don't know how much contact you have with other city leaders.
Yeah, as you might imagine, I am in contact with other city leaders across the state and even the country, actually. And what I'm hearing is that there are similar challenges with nonprofits across the state, especially in urban areas, because that's oftentimes where the nonprofits will locate. And what we've seen in the background is that commercial properties generally are paying less and less of the burden of the property taxes. And so residential has picked up that difference. And so as that has happened over time, the importance of the nonprofits at least participating would be incredibly valuable.
Okay. Scott Sanders, Des Moines City Manager. Thank you for your time, Scott. Have a good weekend.
Okay. Thank you. Bye.
And that just about does it for this Friday Newsbuzz edition of River to River from IPR News. I'm Ben Kiefer on July 10th. Joining us to groove us into the weekend, Cece Mitchell, Studio One host. Hello there, Cece.
Hey there, Ben.
Before you groove us into the weekend, are you up for a little sort of strange historical trivia?
I'll try my best.
Okay. As a matter of fact, it was this week 80 years ago, in July of 1946, that French designer Louis Réard unveiled a revolutionary two-piece swimsuit at a Paris swimming pool. That would be the what, Cece?
That's a bikini.
That's a bikini, right. And I didn't know this about it. I knew the bikini, named after the Bikini Atoll, where the U.S. military had conducted atomic bomb tests just a few days before that French designer came out with this two-piece swimsuit. But it was so scandalous then that traditional runway models refused to wear it. He had to hire an exotic dancer to debut it. Did you know that?
I did not know that. Wow. I understand it, though.
Okay. Now we go on to groove us into the weekend. What do you got for us, Cece?
All right. My first track is by Australian band Vacations. Speaking of bikinis, they've got a sort of dream pop, jangle pop sound going on. I'm really into that sound, and they've just released the lead single to their upcoming 4th studio album. It's going to be called Pursuit of Anything, out October 2nd. They say that the song itself was based on a stressful Zoom call that they had about how impossible it felt to write new music while they were touring. And the whole album is about, quote, happiness as a feedback loop. So I'm not quite sure what that means, but it's up to interpretation. The whole album should be an interesting listen. This is Vacations with Holy Grail.
Starts to fade. Do we say goodbye or find another way? Another
way. Okay, Vacation's new effort titled Holy Grail. Love it, Cece. We have time for one more.
All right, the second track I have for you today is by Role Model. He's a solo artist. He really stole the show at last summer's Hinterland Festival, and he also had a big breakout moment last year with his hit track, Sally When the Wine Runs Out. His third album is going to be called Chuck Timely and the Hourglass. It comes out next month, and he's already put out the lead single to that record. He says is inspired by 90s country and the Doobie Brothers, so see if you can hear a little bit of those influences in this track. Okay. It's called High Hopes 3000 by Role Model.
I end my day the same way it started. Gone in LA, I agree that it parted. Waiting for someone to change my life.
Role Model with High Hopes 3000. You know, from that very first couple of seconds with the piano, I heard the Doobie Brothers. We'll go out with that piece by Role Model, a new effort. And to listen to more of IPR Studio One, we have our own website, studio1.org. We're there for you 24/7. Download the IPR Studio One app would be another way to do it. Or in Des Moines, you can listen to IPR Studio One at 94.1 FM. Cece Mitchell, one of the many talented hosts you'll hear. Thank you, Cece, for grooving us into the weekend.
Thanks for having me, Ben.
Today's program produced by Danny Gear. I'm Ben Kiefer. Thanks for joining us. Have a wonderful weekend.